Good morning, everyone. My name is Denise Hund, and I'm a family care associate with the Northern Nevada Alzheimer's Association, and our local chapter certainly appreciates the opportunity to present to you today through Project ECHO. For those of you who don't know about the Alzheimer's Association, we are a not-for-profit national organization with chapters throughout the nation, providing service support to all those that may be diagnosed with Alzheimer's and related dementias, as well as their very important care partners and community support teams. Our vision is that through the advancement of research, we will be able to see a world without Alzheimer's. Before that happens and when that happens, we have that forward vision. But for now, what the Alzheimer's Association is able to provide through our pillars of care and support are free services of education, support groups, care consultations, and information and referrals for those that are diagnosed as well as their care partners. You will see our presentation is actually on the website, as well as information on the importance of an early diagnosis. The other pillar that we have is concern and awareness. And for those of you that are part of a medical team, it's very important to know about our ALS direct referral process, and that will get us connected with those that need our services and directly guide those to getting to us for those very important information that will help guide them through the disease process. That is posted on the website. One of the important things that we are able to tell you, if that you are a medical provider, that through the HOPES Act, we now have CPT coding for Medicare and TRICARE for physicians, physician assistants, and clinical nurses and nurse practitioners to be paid on a regular basis up to twice a year to case manage particular cases that are diagnoses of dementia and related Alzheimer's diagnosis. So today, we are presenting one of our core programs, the importance of an early diagnosis, as well as what we get asked frequently are, what are the early signs and differences between normal aging and areas of concern? So we find this on Know the 10 Signs. When you refer to us, you will see a lot of information on our website, alz.org, and you will see on our collateral our 1-800 number, 1-800-272-3900, which connects 24/7 you directly to our home office in Chicago, where those that are living with a diagnosis that have questions, or those that are care partners and even community professionals can ask questions 24/7. So that's really important to know that we have access to that. So know the 10 signs, why early detection is important. That's our avenue of support. So if we read this about a gentleman who's a care partner for his wife, Patty, if they would have had a correct diagnosis even 2 years earlier, it would have given us more time to plan, to do the things that can result in a good quality of life. In other words, living well with the diagnosis throughout the process of the disease, to accomplish things that we've wanted to do that got put off for this reason or that. So in the early stages of the diagnosis, people are well able to live their lives fairly independently with support from their care partners, to travel, to live well. We have an early stage support group available in Reno now, so that those early stage care partners and the person that is living with the diagnosis are able to have a support group. We will be going through some of the videos today and hearing from people who are living with a diagnosis and the importance, again, of early detection. This is Marianne, who has a diagnosis, and we're going to kind of listen to what she has to say about what that looks like for her.
With a disease that takes your self, that's pretty scary stuff. And I think that the next wave people with the help of the association, is going to, the next wave of this disease is going to be to not be the only one you know who has it. You know, that we're going to get comfortable enough, and if we who can speak enough, and people say, well, she's not shirking, she can put two words together, she's still living, she's still out there, he's still talking, she's still writing, and there are people doing all of this, then I think the stigma, because that's a word we haven't said, will be lessened. I think it will be diminished. We don't blame people for having cancer. We don't turn the other way. We have historically done that with Alzheimer's disease. And I think that day is gone, and I think that we who live now and know about this are going to be part of the change.
So part of the change really includes that voice of those that are living with a diagnosis from early to late stage symptoms. Briefly, a story about our early stage support group this past year. It was the first year that we had that available in Reno and Sparks area. And that group put together a Walk to End Alzheimer's second team fundraising on their own to just kind of show that vision of we can affect that change too through our voices. So this is what we get a question a lot about, is how do we know what might be symptoms of Alzheimer's disease versus what happens as we typically age? So one of the myths, and fortunately we're hearing a lot of different language changes regarding this, but it used to be, oh, having a little touch of dementia is just a typical part of aging. We used to hear the terms hardening of the eye, of the arteries, or someone might be senile as they age. But in fact, that is not true. We're aging every day, and we see some changes in our physical capabilities, including memory, and some of that might diminish a bit as we age. But having a harder time remembering things is very different than from having a form of dementia like Alzheimer's disease. And this is where we might see changes that actually affect daily life activities. So that's different from being a little bit forgetful, but remembering it later. Someone with symptoms may not be able to recall. That's different than normal aging. So Alzheimer's disease is a progressive disease of the brain that destroys brain cells, causing problems with memory, thinking, and behavior. And if you go in a little bit deeper into what this diagnosis looks like, you will see the terms like plaques and tangles, plaques in the brain that cause Alzheimer's, which we're working on through research to figure out what that is, why that changes, and what we can do through research to detect what that is early. Dementia is a general term used to describe a decline in cognitive functioning. In other words, that's the umbrella term to describe symptoms with causes, changes in memory, thinking, and behavior. Alzheimer's disease is the most common form of dementia by about 70% of a dementia-related diagnosis. And although some treatments are available to help with symptoms, Alzheimer's is a disease that is eventually fatal. In what we would call late-stage symptoms, the body shuts down, including breathing. Another myth is that we hear, well, if I have memory loss, that means I have Alzheimer's disease or dementia. And that is not true. Many people have trouble with memory loss, but it does not mean that they have Alzheimer's disease. Most do not, and it is best to visit a doctor to determine the cause of the memory loss symptoms. So one of the first things that we tell people to do, if you have areas of concern, you need to make an appointment with your general practitioner. Perhaps it's something that can be addressed medically, and this is why we want to get people to their doctor right away, to kind of differentiate what their symptoms are, and if it's a medical situation that can be treated and cured, then that's happening right away. So, for instance, symptoms of depression really can mask memory loss. So we want that navigation to start early. So here's risk factors for Alzheimer's. So one of the primary risk factor, of course, is age. The incidence is higher in women, largely due to women living longer. So as we see people past 71, the risk goes up. Past 85 is up to maybe 50% risk of getting Alzheimer's at an older age. There are also about 5% of the people who are diagnosed with Alzheimer's with what we would call a young onset. And if you hear that term, it means under the age of 65, some people are diagnosed with Alzheimer's. It's rarer, but it does happen, and I just thought I would mention that for those that want to know about the young onset. Other risk factors are people with Down syndrome have a 60% higher rate of Alzheimer's past the age of 65. And the other part I wanted to mention too, it has to do with our general health, and those that did not have access to medical care or proper nutrition throughout their lives are at a higher risk. The other question that we get is, if Alzheimer's disease runs in my family, genetic testing will tell you whether or not you will get Alzheimer's disease. Having a parent or sibling with Alzheimer's disease does increase one's risk of developing the disease, but genetics is not the only risk factor. So we get a lot of questions about the genetic testing. It does not mean that if you have a family member that has Alzheimer's, that you will get it. It's just that it does increase your risk factor. So there is a gene, APOE4, that is linked to an increased risk of late onset of Alzheimer's disease. 23andMe would test for this. It does not mean that you will get Alzheimer's if that genetic link shows up. This is increased at an older age, 85 and older. It's really a good idea to discuss the benefits and risks of testing with a physician or genetic counselor. Having the gene will only increase your chance of developing Alzheimer's disease, but it does not predict the disease. So it's estimated that might increase your risk by 10% or so, if that's in your genetic link. So this is the good news. We get a lot of questions about, gee, what can we do to prevent Alzheimer's? This body-brain connection, and if you're interested, you can look this up. It's one of our clinical trials, and it's called the Pointer Study. That is on our website at alz.org. It really shows that brain health and a healthy body can greatly lower our risk of getting Alzheimer's or related dementia. And that includes physical exercise, learning new things, healthy eating, and an active social life. So if we keep ourselves cognitively alert throughout our adult life, if we find a way that physically exercise that we enjoy and we do it daily, that does definitely decrease our risk. The risk for Alzheimer's disease or vascular dementia is increased by damaged heart and blood vessels. So people who are have high blood pressure or heart disease are at a higher risk. Diabetes in midlife also gives us a greater risk of getting Alzheimer's disease decades later. So that's important to monitor our medical health. Blood pressure, keeping ourselves healthy will definitely lower the risk. And there also is a strong link between head injury and risk for dementia. We've seen a lot of this with sports injuries, and that puts us high in a market of getting Alzheimer's more likely later. So for those of you that are sports enthusiasts, always wear your helmet. Beware of your risk taking because it definitely makes a difference. This is showing up in young folks that were active post-mortem. They see it in their brain, how much damage was done, for instance, with sports injuries. So stay safe if you are active. So the 10 warning signs, and this is on our website to really kind of monitor and keep track of this if you have concerns for someone you know, that these are really a good measure to kind of figure out what does this mean and how is it different from normal aging. So this really is key to memory changes that disrupt daily life. So forgetting something recently learned, for instance, learning something like a new cell phone may take a little bit longer for someone who hasn't grown up with technology, but eventually they'll learn it. They'll find a technique to learn it. Someone with areas of concern may not be able to ever learn something new, like their new cell phone. Asking the same information over and over, that short-term memory loss. People close to someone that's having concerns may notice that. It's called short-term memory loss, and it's because they didn't remember that I asked you that question. So that's part of the disruption that we see, disruption in daily life. Relying on memory aids or family members for things that you used to handle alone. So that's where people start to have a little bit of struggle with staying in a routine and remembering their daily tasks at bay. So you might see folks really trying to come up with some memory strategies beyond what someone with regular just changing in as we age. They really need structure, and they realize probably in the early stages that they are struggling. So this is where we want to be attentive to that and start to log in what those changes might seem to be.
Well,
we're not going to get through all the videos in this presentation, so I'm just going to do a few of them. The other area of concern that's different from normal aging is really problems developing or following a plan. So you might see someone that was really active, for instance, in planning a vacation. And there is a time where they're not able to do that. That really takes structure to follow a plan, different from normal aging. Also, problems working with numbers. This is where we see people start to make mistakes on their bills, or not really understanding numbers or being able to make change. That just becomes more difficult to understand. Problems following a familiar recipe. You may see this with someone who's had a family recipe for decades, second, third generation, and all of a sudden it's always in their head, and all of a sudden it's Thanksgiving, and they have no idea how to follow the recipe, or they don't remember the recipe. People having difficulty not only keeping track of bills, or maybe forgetting what bills they have, different from normal aging. Really challenging challenges with concentrating. So if it's time to do a very basic task, that concentration starts to get shorter and shorter, much more difficult to do, longer than before to do common tasks, like make appointments and make sure that you get to those appointments.
We have a question here.
Sure.
What about when someone repeats stories that they have already told? Would that be equally concerning as asking the same question?
Absolutely. That's just on that same spectrum where there's that repeat story. They don't remember that they've just told you that story, so they'll repeat it again. Different than you might remind your friend, hey, you just told me that. Oh, yeah, that's right. But then repeating it again. So that's where the difference comes up. So difficulty completing familiar tasks. So it might be, gee, I need to go to the grocery store today, but what does that look like? What do I need to buy? Trouble driving to once familiar places. So I've had people tell me, you know, I'm on my way to the store, and all of a sudden that's a familiar route for me, and I look around and I don't know where I am. I've gotten lost in a familiar area. Managing budgets at work, especially that young onset. People are at their job, and all of a sudden they just really forget what they're doing, or they don't know their tasks at a job. difficulty remembering rules of a favorite game. So people that were always engaged with that, all of a sudden they're playing a game and they don't know the rules anymore. That's different from normal aging. Again, there's confusion with time or place. Losing track of dates, seasons, and passage of time start to not make a difference. So for instance, you might have someone and they put on a winter coat and walk outside. That doesn't really make sense. Or it's January and they put on a pair of shorts and a t-shirt and walk outside. So that date tracking of what seasons are that start to go away. For instance, we had a family who said, well, we told our mom in July that we were coming for Thanksgiving this year. And she started to get ready for a November visit. That's just lack of being able to be able to know what time is, forgetting where they are and how they got there. So it might be you're on a familiar walking path and you can't find your way home. That's different in an area, certainly an area of concern. There's our visual changes happen as we get older, but for people who have areas of concern with their visual surroundings and have difficulty reading, trouble judging distance, this is where we start to see unexplained car accidents, for instance. Problems determining what color or contrast, so that might also look like unexplained falls, going from a carpet to a linoleum or bag, that you can't distinguish what that space is, and people start to have unexplained falls. Judging distance driving problems becomes a real issue. So we want to look at that safety network too, another reason to get to your doctor and find out what might be going on. Also, perceptual changes. So someone walking fast beside someone might startle someone because they don't know that person came out of nowhere and they might be startled by that. That's a different visual image change than normal aging. New problems with words and speaking. So you'll see people withdrawing from conversation because they have trouble following that conversation. So they'll start to disengage. Difficulty with free flow speech. So you might hear a halting of speech. Difficulty being able to come up with a word. Starting a conversation, but being unable to continue the conversation. And then again, repeating what has already been said, that same concern for repeating information. Finding the right word. We've all forgotten words and then came up with it later, or calling someone by the wrong name. It's because they're not remembering that name or can't recall it later. That's key. We've all been forgetful, but being able to recall it later is an important difference. That's not normal aging. Misplacing things, which we've all done. We've all lost our cell phone and keys, I'm sure, but we can retrace our steps. Someone who has symptoms of concern is unable to retrace their steps to locate a missing item. Putting things in usual places. Keys have been found in the freezer, wallet in the fruit bowl. So these are things where you're losing things because you can't keep track of things and you can't retrace your steps. That's not a symptom of normal aging. Accusing others of stealing happens to family members because the person cannot remember what happened to their item that they have lost. They can't retrace their steps, so they might likely accuse a family member. The same thing happens with money management because they are not able to manage that effectively any longer. Decreased or poor judgment. This is where the person that used to be really on top of things about their decision making has a decrease in that. Poor judgment with money because they are not able to manage their money. We've heard families say, well, we found out mom gave $60,000 away to telemarketers, and some of those well-meaning, but she was losing track of her money. Someone who's spending impulsively and that's not their pattern, that is also an area of concern. Also, again, wearing clothing that's not appropriate for the weather. So other things that we see that are concerning is that the people are withdrawing from their social activities. They have their hobbies as set up. They're important, enjoying things that they used to enjoy, and they're not able to participate any longer. Losing track of a favorite sports team. You know, a San Francisco Giants fan that's not keeping track of what's going on with the team this year, that might be an area of concern. They might have their hobbies set up, but they can't follow through. People that aren't showing up for family gatherings and social activities and withdrawing, that's an area of concern. Also, we see changes in mood and personality, where people may become very confused, suspicious, fearful. They have anxiety and agitation. They may be realizing that they're losing the ability to effectively communicate. And I know I'm going through this fairly quickly. It is a lot of material. So what should you do if you see someone with some of these concerns and or concerns for yourself? This is the good thing about how we envision getting help and diagnosis early, is that we're more open to talking about areas of concern. Like Marianne said, if we had cancer, we wouldn't be not sharing our concerns. The same with Alzheimer's and related disease. So talk to people about what you're seeing. The person that has some symptoms may be expressing their concern. The first thing to do is visit the general practitioner and to get the right treatment as soon as possible is crucial. Again, that medical clearance is important to make sure that it's not something that's treatable. Also, writing down these concerns, letting your general practitioner know ahead of time why you're coming in. Bring a friend or family member with you always. So the earlier, the better for a diagnosis. You will see on our handouts the benefits of an early diagnosis, why, the biomarkers, and the things that we can do early when people are able to express what they want and speak up for themselves for a plan. So you still hear, oh gosh, why would I get diagnosed? It's progressive, it's not treatable. I'm just not going to go in and do that. It's the only way to get a diagnosis. If there is an early diagnosis, is the only way to get early treatment for any diagnosis. There are ways to get help and support, and the Alzheimer's Association is able to do that throughout the disease process from early to late stage. So this is why it might not be Alzheimer's. Some can be detected and reversed. If it's detected as depression, those symptoms can be managed. It might be life-threatening. It might even be a brain tumor that can be detected and treated early and properly. So it's important not to just assume it's Alzheimer's, but to get a clinical diagnosis that helps us navigate what that looks like. You don't need a complete set of diagnostic tests to know if you really have Alzheimer's disease. We are getting close to about 90% accurate on Alzheimer's itself. And part of that is getting early treatment, but you have to know what you're treating. So we can kind of dispel what the memory loss, where that's coming from. And it's important to be thoroughly assessed and bring in a team that can clinically do that as well. So here's the steps. First, get a history from the patient and or their primary care partner, close family and friends, because likely at this point, other people are knowing and or noticing this as well. Lots of support on our website about how to navigate that for a family friend or for yourself. Early diagnosis. That starts with a physical exam, a mental status exam. You will see that the CPT codes include a more thorough exam that can be paid for physicians, physician assistants, nurse practitioner, and clinical nurse specialists to be paid to manage the case once there is to clarify the diagnosis. Neurological exam, the neurologist can run those brain imaging, MRI or PET scans. That helps us put together and navigate what this looks like. So that can be, what are some of these things that can be treated? Vitamin deficiencies and anemia, like deficiencies of B12 can cause symptoms. excessive use of alcohol, which also can cause symptoms. This time of year, something like dehydration is going to cause symptoms, or a urinary tract infection, all treatable. Medication side effects as well. So that's why the initial test to kind of go through all of that and treat it if necessary. Here are some other forms of dementia. Vascular dementia commonly happens, for instance, with a stroke. Many people might have a mixed dementia, vascular dementia and Alzheimer's. Frontal temporal lobe dementia, FTD or FTLD, it looks a little bit different than Alzheimer's. It has a tendency to hit a younger population, starting out with maybe some behavioral symptoms. The executive functioning is starting to be affected, so somebody that's doing a really great job at their work might start to act a little bit bizarre. And the unfortunate part of this is that a lot of people get fired because they have a diagnosis, they have a brain disease. So we want to be attentive to that. Lewy bodies is another form of dementia, or form of dementia with Lewy bodies. That also looks a little bit different. The medications for Lewy bodies is going to be different than what someone might give someone for Alzheimer's. So Lewy bodies looks a little bit different. It looks a little like Parkinson's, and it comes with some delusions and hallucinations. So a good clinician should be able to sort all of this out. So what happens? So now you've navigated the initial part, navigated the medical part, and you're diagnosed with dementia-related disorder, Alzheimer's or others. Here's what can happen when you have that early diagnosis and what we want to advocate for. You can explore the treatments to provide a relief in symptoms. You want to make sure that we want to look at folks in the early stages that can remain absolutely as independent as possible for as long as possible. So with support services and a vision with help from the Alzheimer's Association, we can make that happen. There's a lot of folks actually who are living alone with an Alzheimer's diagnosis, and they could do that for a while with the right support and care plan. It also, especially in the earlier symptoms, the opportunities to participate in clinical trials. That's also on our website, and very important for people to know, to kind of give yourself another avenue for making a difference for the future.
Early diagnosis is very important, because it's like with anything, if you start early, you'll have more success in the treatment of it. And with Alzheimer's, there is no cure, but it can be made livable. You know, the medication can help you live a more productive life with it.
So that's, again, Justine is speaking up for herself, and she knows that making that plan and a vision for the future is important. There are some medications that can manage some of the symptoms, but we're not quite there yet for finding one that can actually stop the progression. So again, when you look at these medications, it's something to talk about with your doctor. There's some that have been out there for a while, Aricept and Namenda, again, something to talk about with your doctor that can temporarily improve some symptoms and can help with behavior and mood changes that sometimes happen, so that management of some of those symptoms can be helped with some medication. But again, you want to talk with your doctor with what treatment is best, have your medications regularly reviewed. The wellness checks through the Medicare guidelines is a good way to have your medications looked at yearly, as well as update a cognitive test. So here's where we want to be able to have people with an early diagnosis. They certainly can participate in arranging their own care. What do they want for the future? Who do they want to help? We do know that this is a progressive disease, but every person with a diagnosis is going to exhibit different symptoms at different times. We do know things that are going to change. So when in those early symptoms, people can say, hey, this is what I would like. This is my care plan. We want to navigate safety, financial and legal matters absolutely right away. What does transportation look like? We know that that's going to be maybe an issue in the future. The Alzheimer's Association has information and referral and support to help you navigate all of these situations that might be coming up. Be empowered to make decisions. Say who you want to help and how, and support the care partner along the way. So that care team and social network is really important to bring those helpers in to help navigate a future plan. So we tell this, actually we should all be doing this, to seek the proper legal advice, to make sure that documents that were maybe reviewed and in place some years ago, post-diagnosis, that's going to look a little bit different. Make plans for medical decisions as well as financial. Also, for the primary care partner, there needs to be a plan in place for what if something happens to the primary care partner. There needs to be a plan in place. So the legal advice can come from an elder law attorney or a senior law project, which we have referral lists for those. You want to make sure that you have a person in place that can make decisions on your behalf when you no longer can. So these are your support services through the Alzheimer's Association. That 1-800 number, again, is in place 24/7. It is available in not only in Spanish, but I think 125 other languages. So you would, it could be a simple question where, hey, where's that class next week that the Alzheimer's Association has? It's linked nationally. So for instance, we have long distance caregivers. So mom lives in Florida, we're here, how can we help? The 1-800 number will get you to your local chapter so that you can get help and advice. We provide at no charge support groups, education programs, and available information and referral resources. And online education that's available locally. So if you are connected with us, you will get those announcements and support group information. So here's how we can get involved. The Alzheimer's Association promotes advocacy through the AIM Act, Alzheimer's Impact Movement. The good news is that we are increased funding by multiple folds, $400 million a year for the last 3 years for research and funding. The AIM Act has really made a difference in public policy and advocacy. In September, you might see announcements. You're starting to see that is getting to be what we call our walk season, and that's a big fundraiser for the Alzheimer's Association. Our walk is, and you can see this online as well if you want to sign up for a team and register. It does make a difference. It not only goes some to research, but it comes back to us locally. So our local team can help provide services and stay in place until we find research finds a cure. Our Alzheimer's Association walk is September 22nd here locally in Sparks. That does indeed make a difference. We really rely on our volunteer team, and you can do that locally in many different aspects, whether it be helping with the walk, or to be an advocate, or to help support research by signing up for a clinical trial is another way to do that. We are advocating for the almost 6 million people estimated that live in the United States that need that care and support for now. Also, the 44,000 that are diagnosed that live in Nevada, 43,000 in Nevada. And some are still out there without a diagnosis, and that's why we want to not see that happen any longer. So here's what to do. If you notice signs, you want to talk about what's happening. You want to approach it. We can help you do that. We want to see that concern and awareness come with the entire team, including the care partner. To see a doctor. If you are a member of if you are on a medical team, whether that be a medical social worker, a physician's assistant, you can also make sure that you know that the Alzheimer's Association through ALZ Direct Connect will connect with you with the process of how that gets to us as a local team so that we can start to help. Our local team includes family care associates that we have a Latino outreach family care associate that can help with our Spanish-speaking community. And we have a rural outreach community provider that goes out to Elko and Ely and it reaches those rural communities. So we want you to follow up with resources from our local chapter, follow up with the diagnostic and treatment recommendations, and that supports this through all the avenues of the disease process. Okay.
My passion in life is to have people diagnosed as early as I was, so that the good part of their life can be extended. I wear an Alzheimer's bracelet every day that says there's reason to hope, and I think that's kind of my mantra, that, you know, if we can find the people that are out there and get them to a good place where the guy knows, the gal, whatever, knows what they're doing, and get diagnosed and get help.
Very good. So again, on the website, you will see our handouts for those that might be interested in what the CPT codes look like to be reimbursed through Medicare. You will see on our handouts a planning and toolkit that will help with the assessment process, as well as the CPT codes and how to navigate that. I think that's really important. That will allow follow through for up to 2 times a year. We believe that people should be revisiting a memory care specialist or a clinician at least yearly to monitor the process. That again helps with planning, helps the care partners know the support that might be needed, helps you to connect with local resources available, which we're able to do through the Alzheimer's Association. And we're available for questions if anyone has one.
Okay, we'll open it up for questions. If anyone has questions, feel free to send them in through the chat box, or there's also the Q&A function. Anthony, did you have a question? Any questions out there, please feel free to use that chat box.
I'll give my my email through the Alzheimer's Association is Denise Hund, and my email is alzdhund@alz.org, dhund@alz.org, especially if you are a clinician and you have any questions about how to refer to our resources. If you have family members that have a diagnosis and you would want to know how to get directly to us, that would be your contact. Then we'll start to navigate. We also do care consultations at no charge, so a family care associate can sit down and kind of guide individuals living with a diagnosis and their family care partners through the process to get information and help.
So how early can these signs begin?
You know, the part of the biomarkers for an early diagnosis and research is really to determine, because it's sometimes there are no symptoms that the biomarkers are there maybe 10 years early. So by the time there are symptoms and the diagnosis has been in place for a while. And again, our families, we have worked with people as young as in their 30s and 40s. That looks a lot different than someone that might be a little bit older because of their, the time that they are in life. Sometimes it's 10 to 15 years before we can really pick up on what that research looks like. So the clinical trials are looking at biomarkers. They're looking at, there is a very rare form of Alzheimer's, is a familial form of Alzheimer's, where, and that's probably about 1% that is diagnosed through to Alzheimer's, but 100% of those family members will eventually get Alzheimer's, and sometimes young. So there's, trial opportunities to look at what that looks like. When does it happen in the brain? How and why? So there's a lot of different ways that we can look at the health and research aspect to that before symptoms show. So that's really key, before symptoms show, because by the time there's symptoms, there's already a diagnosis.
How could a support group be set up for a company?
To ask about support groups through the association. Yes, I'm assuming a site location.
Yeah.
Yeah. Currently, we have about 17 support groups in place. If there's and that includes rurals. If there is a need for a social work, or excuse me, a support group, you talk directly to us, and we would navigate what that need and what that looks like. In the meantime, if you are on our, if you connect with me and you want to be on our, if you're not receiving information through the Alzheimer's Association yet, you would get information on what our support groups look like. So you can connect directly with us with that question, and if there's more support groups needed, we'll look at that. Our support groups currently include the early stage support group for those that have a diagnosis and can still discuss it in a supportive way. We have support groups for children of aging parents. We have support groups for spouses. We have a men's group, and we have about 14 outreach groups in Minden, Gardnerville, Fallon. Our associate, Anna Karen Lamas, runs a support group for Spanish speakers. So we try and kind of get a network of folks, opportunities to join different support groups, and that's on our website.
If there aren't other memory problems, but there's a change in personality, such as they become mean, is this a sign of dementia, or must that be alongside memory loss and other indications?
Yeah, no. The symptoms that we went through today, that the 10 signs, not everyone is going to have some of those symptoms. So a change in mood or personality, aggressive behavior, someone needs to get in and address that with the general practitioner. What's causing that change? What's causing that mood change? So you'll see all 10 signs, but not in every person. For instance, if someone was an engineer, they may not have challenge with numbers because that's so in place for them. So it depends. So again, it's very individualistic. And I think also what helps is a person's history and background, so that the clinician knows, well, that might be part of what we look at with our guidelines for different aspects for going through the clinical process. So if someone's an engineer, their struggle with numbers might not show. So part of that history, and when you put that together for the clinician, is this is what the person was like, and this is their personality, and this is what they did for a living, their social network, those kinds of things. When you see changes in that, that's an area of concern.
How many signs need to appear together to be a concern?
I'd say if people are having 3 or 4 of these, you need to write this down and document and address them. And sometimes you'll hear what's called mild cognitive impairment. And some people are diagnosed with that. That means that they're having some struggle, and they might be in a higher risk of that eventually being Alzheimer's, but that struggle might be what we call executive or instrumental activities of daily living. They're fine most of the time, and someone by then might need to take care of money management and transportation, those kinds of things. But again, it's anything that disrupts normal functioning and the ability to live your life without disruption that is areas of concern.
Do you have any advice on approaching someone who appears aggressive with a change in personality?
Yeah, that absolutely sometimes happens. There's denial. There's not understanding what's going on. That's not me. You're not. I don't believe that to be true. That is a real struggle for the care partners. And I think with that, please, get connected with us and you can talk. We kind of start out with a little mini care consultation, and we might say, what is it that you're seeing? You can get a family care associate through our 1-800 number. If you need to navigate that a little further, you can talk to one of our family care associates here locally, and we really have techniques and strategies to use for that. This is not uncommon.
My grandfather's been in and out of the hospital with minor strokes and falling, breaking his back for the last couple of years. Last time he was in the hospital, the nurses were saying they thought he had Alzheimer's, but my mom and aunt don't believe it. They say he's always had a bad memory, and all the medication and being in and out of the hospital has caused it to worsen. Could his memory problems really just be all the trauma of being in and out of the hospital and different care clinics?
Well, that certainly will increase symptoms of concern. But again, we hear a lot, oh gosh, he's always been a little forgetful or a little aggressive or whatever. But that doesn't mean that those symptoms aren't there. Being confused in and out of the hospital certainly increases symptoms, but I would just start to kind of document a little bit more of your concern and approaching it directly. With your family members, you might say, oh, these are some things I found out from the Alzheimer's Association. It's available to you too. Maybe it isn't, but that needs to be addressed medically. Again, it helps people navigate a future plan.
Thanks for all the questions, everyone. If you have more, please keep sending them in.
And join us for the walk. I'm telling you, it is inspiring and fun. There's all ages there. It makes a difference for us locally. There's folks that are living with the diagnosis that are early engagement speakers. It's pretty impressive. I think I mentioned our early stage support group. They went by Kickin' Owls, and they raised a lot of money. And that's pretty impressive to say, hey, help me out here. I've got this disease, and we can navigate the future through your donations. So it does make a difference. And it keeps our team in place too. So come out to that if you can.
Okay, I don't see any other questions coming through, so I want to thank everyone for participating today. It was great to have you all. We hope we'll see you again soon.
Yeah, thanks to Project Echo, and please feel free to reach out if you have any more questions. Again, it's dhund@alz.org. Thanks a lot.